So we've talked before on this call about the money we received from the state. It
Right.
just showed up one day. Have more stimulus funds come into Kaweah Delta like that?
Unfortunately, no. We did, you're right, with no action on our part, they just looked, the federal government just looked back historically and what have we paid hospitals for taking care of Medicare patients? What's their annual Medicare payments that we make to them? And so Kaweah Delta got its proportionate share, which was about 13.2 million. So we got that a couple months ago and really haven't received anything since. We did, earlier this week, we reported to the federal government a lot of statistics to show how impacted that we have been by the virus. Mostly they were looking at, what have been the total number of COVID admissions, deaths, employees, things of that nature. Really didn't look at, what's been your lost revenue, which has been the biggest impact on us. But we had to submit that information to potentially be eligible to participate in the next distribution of 10 billion. And that's supposed to be earmarked towards hospitals that take care of a disproportionately higher percentage of Medicaid patients, or in California, Medi-Cal. And we clearly do. So it's likely that we'll get some of that 10 billion, but we don't know how much. But our whole right now is closer to 40 million. So the 13.2 million certainly, helped put a dent in it.
Right.
But it's still a deep hole that we're trying to climb out of. So we are desperately hoping that the federal government will continue to provide funding for hospitals. The House of Representatives did pass the HEROES Act, which was like the Stimulus 4.0, and it had funding for hospitals, but it died in the Senate, and it hasn't been taken up again. So that's what we're continuing to reach out to our congressmen and women, our senators, and telling our story, and hopefully, California has been hit really, really hard. The American Hospital Association reported earlier this week that hospitals across the country have suffered $200 billion in losses. And that was just, I think it was through April. May was a terrible month for many, many hospitals. So.
Yeah, a lot of requirements have been put on hospitals that we hadn't budgeted for. A lot of things have just
shutting down.
Census and services.
Yeah.
A lot of things have played into that,
Right.
And so a lot of stress on our leadership now to. This is budgeting time.
Yeah, it is. It's. I've always told our folks that being a leader in healthcare is probably one of the hardest jobs in the world, frankly. It's rewarding. It's a calling. People are drawn to healthcare, and they're some of the most amazing people. But it was hard before the pandemic to be a healthcare leader.
Yeah.
When you got 40% of hospitals pre-COVID were operating in the red. So many hospitals have closed in California. We've seen so many hospitals close in our own county over the years because it's just financially it's really difficult. When 85% of your revenue comes from Medicare and Medi-Cal, and literally you're getting no increase year over year over year, but you're trying to attract great physicians, attract great staff, and your drug costs keep going up, the cost of technology, hospital margins just continue to shrink and shrink and shrink. So,
Okay.
but great team though.
Yeah. Yeah.